Tackling America's addiction crisis. Good evening, ladies and gentlemen. Tonight we address the pressing issue of addiction in America.
Harold, it's alarming to see that over 48 million Americans are living with a substance use disorder, yet only 5% receive treatment. We need better access to effective treatments.
Absolutely, Bernard. It's evident that the addiction treatment system faces numerous obstacles, from workforce shortages to stigma. We must break down these barriers.
Well, Vincent, let's not forget that individuals must also take responsibility for their actions. Addiction isn't solely a societal problem.
Karen, while personal responsibility is crucial, we should also acknowledge the systemic issues at play. Many people with substance use disorders face obstacles to getting help.
Sheila makes a valid point. How can we make addiction treatment more accessible and effective?
One way is to improve outreach efforts. We need to identify and engage individuals who need help rather than waiting for them to seek treatment.
Additionally, reducing the stigma around addiction is essential. We must treat relapses as part of the recovery process, not as failures.
But we can't just throw money at the problem. We need to ensure that those who receive help genuinely want to change.
Karen, while motivation is vital, we must remember that addiction often clouds judgment. Let's not forget the moral and practical cases for resolving this crisis.
Well said, Sheila. Our nation has overcome significant challenges in the past. Can we apply similar determination to solving the addiction crisis?
Absolutely, Harold. We have the knowledge and tools. Now we need the willpower to fully address this national trauma.
It's time to bridge the gap between knowledge and action. We've done it before, we can do it again.
Let's not forget individual responsibility, but let's also work together to create a more accessible and compassionate addiction treatment system.
Thank you all for your insights. It's clear that tackling addiction requires a multifaceted approach. Together we can make a difference.
Absolutely, Bernard. These evidence-based strategies have been around for ages, and yet they're barely used.
Well, you liberals always want to throw money at problems. We need to be tough on these addicts.
Let's break it down. The article highlights positive reinforcement strategies. Bernard, your thoughts?
Positive reinforcement has worked, but it's not being implemented enough. We need a shift in approach.
And Karen, while I respect your viewpoint, it's not about being tough, it's about being effective.
Oh, Vincent, you're just too soft. These addicts need discipline, not rewards.
The data shows that effective treatments are underutilized, with only a small percentage receiving medications or therapy.
That's right, Harold. We're failing those who need help the most. We must do better.
Agreed. It's not just about being soft or tough, it's about providing the right care.
All I hear are excuses. If they can't quit, it's their fault.
Moving on, the article points out the need for better oversight and updated regulations. Thoughts?
We must hold treatment programs accountable. It's time for proper regulations.
Accrediting agencies are failing. We can't let that continue.
More government control? No, thank you.
Improved data collection is essential for understanding the scope of the problem.
We can't solve the problem if we don't know the full extent.
Data collection is crucial for targeted efforts and better outcomes.
More government intrusion. We need less of it.
Lastly, professionalizing the workforce. Thoughts?
We need well-trained professionals to provide effective care.
The workforce needs support and training to handle this complex issue.
Just another way for liberals to spend taxpayer money.
And that's a wrap on tonight's discussion. Back to you, Sheila.
Thank you all for joining this spirited debate on addiction treatment in America.
Welcome to our discussion on the addiction treatment workforce crisis. Let's start with the facts.
Harold, it's truly alarming that we're facing such a severe shortage of addiction treatment professionals, especially when the demand for these services is skyrocketing.
Bernard is right. This issue has been a concern since 2015, when experts first warned about catastrophic behavioral health shortages. Sadly, the pandemic has only exacerbated the problem.
Oh, please. These professionals need to work harder instead of complaining all the time. People should take personal responsibility for their problems instead of relying on others.
Let's not jump to conclusions, Karen. Burnout and low compensation are real problems that affect not only the professionals but also the quality of care provided.
Harold, did you hear that fewer than 1% of doctors specialize in addiction treatment? That's shocking. We need more medical professionals dedicated to helping those struggling with addiction.
And let's not forget that only about 5% of eligible providers have obtained the special license required to prescribe buprenorphine, a medication that has proven effective in treating opioid addiction. This shortage is a significant barrier to access to life-saving treatments.
Maybe they should all become addiction specialists, problem-solved liberals.
Karen, we need to find practical solutions instead of resorting to insults. Comprehensive training for medical graduates in addiction medicine is one solution that could attract more professionals to this field.
Absolutely, Sheila. We should make public funding for medical schools contingent on addiction medicine training. Ensuring that every doctor graduates with at least basic knowledge of addiction treatment could significantly expand the workforce and improve care quality.
Tuition reimbursement and loan forgiveness programs could also incentivize more individuals to enter this critical field. Considering the economic costs of substance misuse and abuse, it's a worthwhile investment.
More government intervention? That's your answer to everything, liberals.
Karen, it's about addressing a crisis that affects many lives. We need to consider all options and work together to find solutions that benefit everyone.
Legal actions have been taken in some states to address violations related to addiction care.
That's urgent and commendable work, but we need more than lawsuits to solve this crisis. We must address the root causes and systemic issues leading to these shortages.
Policymakers should also focus on expanding telemedicine. Adjusting licensure and credentialing rules could enable therapists to provide services where they are most needed, breaking down geographical barriers to care.
You liberals want to spend. It's all about personal responsibility and individuals making better choices.
Addressing the addiction treatment workforce crisis requires a multifaceted approach. It involves training more medical professionals, providing financial incentives to join the field, reducing regulatory barriers, and ensuring that individuals in need have access to high-quality care. We all want the same thing: a healthier and more resilient society. It's about finding common ground to achieve that.
Welcome to our discussion on fixing funding for addiction treatment. Let's begin by examining the facts.
Harold, the challenges healthcare professionals face in providing addiction treatment are immense. It's heartbreaking to see that patients in dire need often face delays and barriers in getting the care they deserve.
That's right, Bernard. The complexities of starting patients on buprenorphine, a critical medication for opioid addiction, require careful monitoring and empathy. But with limited resources and funding, clinics struggle to provide this level of care.
Well, Bernard and Vincent, maybe these clinics should figure out how to manage their resources better instead of relying on government handouts. Personal responsibility, anyone?
Let's not jump to conclusions, Karen. The funding issue is complex and there are legitimate concerns about sustainability and quality of care.
Harold, did you hear that many substance use disorder treatments are heavily reliant on grants instead of health insurance? This creates instability and leads to interminable wait lists.
And Sheila, the Affordable Care Act has improved the situation to some extent by requiring insurers to cover behavioral health. However, enforcement of these parity laws has been weak, resulting in denied claims and reduced services.
More government regulations and spending, typical liberal agenda. Let the market sort it out.
Karen, it's not about more government intervention. It's about ensuring that individuals in need receive the best possible care. We need to find common ground to address this crisis.
In recent years, regulators have documented sweeping lapses, including low reimbursement rates and denied claims.
That's right, Harold. The current system is failing patients and discouraging professionals from entering addiction medicine due to low compensation and unstable funding sources.
Harold, there's hope. The Biden administration is taking steps to enforce parity laws and improve Medicare's coverage of addiction treatment, but we need comprehensive change.
Here we go again, liberals wanting to spend taxpayers' money. Personal responsibility should be the priority.
In conclusion, fixing funding for addiction treatment requires addressing reimbursement rates, expanding Medicare coverage, and using grants more strategically. We need a balanced approach that ensures quality care without overburdening taxpayers. Let's work together to find a solution that benefits everyone.
Welcome to our discussion on liberating methadone treatment for opioid addiction. Let's dive into the facts first.
Harold, it's a travesty that methadone, a proven treatment for opioid addiction, remains difficult for many Americans to access. We must address these barriers urgently.
Absolutely, Bernard. The limited availability of methadone clinics and the strict regulations surrounding its use are hindering those in need. We need a more sensible approach to save lives.
Here we go again with government interference. People should take responsibility for their actions instead of relying on taxpayer-funded clinics.
Let's remember, Karen, that the opioid crisis affects millions of Americans and addressing it requires a balanced approach. Let's explore the challenges and potential solutions.
Harold, did you know that 80% of American counties lack methadone clinics? This results in long wait lists and forces patients to travel long distances for daily medication. It's not sustainable.
Sheila, it's crucial to highlight that methadone treatment requires mandatory counseling and urine testing. While some caution is needed, these requirements can vary from one clinic to another.
More regulations, more hand-holding. People need to take responsibility for their choices.
Karen, we must ensure that those seeking help receive quality care. However, it's clear that we need reforms to make methadone treatment more accessible and effective.
Some methadone clinics employ punitive measures while others provide comprehensive support. This inconsistency can be life-threatening for patients.
Harold, I've heard stories of patients facing obstacles when they change jobs or locations, which shouldn't be a matter of life or death.
Harold, we must recognize that methadone can be life-saving, but the outdated regulations and stigma surrounding it are preventing many from accessing it.
More government intervention. That's all you liberals want. Personal responsibility should come first.
In conclusion, we need to lower barriers to methadone treatment, loosen strictures, and integrate it into existing healthcare facilities. It's time to modernize methadone treatment and save lives. Let's work towards a solution that benefits everyone.
Welcome to our discussion on the addiction dilemma, bridging divides and overcoming challenges. In Chapter 6 of the New York Times opinion piece, we explore the obstacles faced by individuals with addiction in the criminal justice system. The article highlights a case where a person had to choose between discontinuing medication for opioid use disorder or facing prison. It also discusses the lack of proper treatment for those in the criminal justice system.
Thanks, Harold. It's crucial that we address these issues. Our criminal justice system often fails to provide adequate care for individuals struggling with addiction. The fact that drug courts don't consistently refer people to proper addiction treatment is a real problem. It's like denying someone with a medical condition access to the right medication. That's just inhumane.
Well, Bernard, let's not forget the legal complexities here. While treatment is essential, we can't ignore the concerns about diversion and misuse of addiction medications. The system needs a delicate balance, but yes, the lack of coordination between health and prison officials is a systemic failure. Our society should prioritize rehabilitation, not punitive measures.
Of course, you two are always quick to blame the system, but we mustn't forget personal responsibility. These individuals got themselves into this mess. Why should taxpayers foot the bill for their treatment? If they choose to misuse drugs, that's on them. And as for harm reduction, it's just enabling their behavior. It's time we focus on the law-abiding citizens who are suffering because of this.
Thank you all for your perspectives. Now moving on to Chapter 7, which discusses the issue of infighting among stakeholders in addressing addiction. It highlights divisions between harm reduction proponents, the recovery movement, and supporters of different treatment approaches. The article suggests that collaboration is crucial for making progress. What are your thoughts on this internal strife?
Sheila, it's disheartening to see how disagreements among groups trying to help actually hinder progress. We need a united front in the fight against addiction. Harm reduction, recovery, and medication-assisted treatment can coexist and complement each other. It's time we prioritize saving lives over ideological battles.
I agree, Bernard. This infighting is counterproductive. Each approach has its merits, and they can work together. Let's not forget that we're dealing with a complex issue, and there's no one-size-fits-all solution. We should be open to diversity in treatment methods and support systems. That's how we'll make real strides against addiction.
Here we go again with the kumbaya talk. You liberals are all about coddling and enabling. We can't just throw money at every approach and hope something sticks. The 12-step programs have been around for a reason. They work for many. We shouldn't be wasting resources on unproven methods like harm reduction. We need to focus on what actually gets results.
Let's try to find common ground here. While it's essential to respect different perspectives, we can agree that addressing addiction requires a multifaceted approach. Combining the strengths of various methods can benefit everyone involved. Now shifting gears, the fentanyl crisis is a growing concern. What role should law enforcement play in this complex issue?
Fentanyl is a game changer, Sheila. Its potency and rapid addiction potential make it a public health emergency. Law enforcement can't solve this problem alone, but they should work alongside health officials to protect communities. Harm reduction strategies can include safe consumption sites, which can help keep drug users safe and reduce public drug use.
Absolutely, Bernard. The fentanyl crisis requires a coordinated effort, It's not just about arresting drug dealers. It's about understanding the root causes of addiction and providing harm reduction and treatment options. We can't arrest our way out of this problem.
I'm glad you brought up the fentanyl crisis. It's a clear example of how we need strong law enforcement. Communities are suffering from rising crime rates, and we must prioritize the safety of law-abiding citizens. Harm reduction has its place, but it shouldn't overshadow the need for effective policing.
Thank you all for your insights. In summary, addressing addiction in the criminal justice system and overcoming infighting among stakeholders are critical challenges. Finding common ground and prioritizing the well-being of those affected by addiction should be our ultimate goal. Back to you, Sheila.